And thanks for being flexible and the change of location. I'm glad we're not doing this outside. So my name's Robyn Merrill, and I'm with Mainers for Healthcare. And we're here this afternoon, because too many Maine people lack access to affordable health care. And too many hardworking families are forced to make the choice between health care and putting food on the table. And that's wrong. And there's something we can do to address that this November. And that is voting yes on 2 at the ballot box in favor of Medicaid expansion. Medicaid expansion, expanding our Medicaid program, will provide health insurance to 70,000 Maine people who currently lack access to affordable health care. It will strengthen and bolster our economy, making for a healthier workforce. It will create jobs, over 3,000 jobs throughout the state. It will support hospitals, rural hospitals, community health clinics, which in turn will support access to health care throughout our state. You know, and it goes beyond the impact, and the benefit goes beyond people who would be directly impacted, the 70,000 people who would be able to access health care and gain insurance. It would also bring down costs in the private market. We know from research, states that have expanded their Medicaid programs have seen significant benefits, have seen their private market costs stabilize or even reduced as a result of expanding their Medicaid programs. So there are benefits, there are many, many benefits that I could list for you this morning, but I think more importantly, we want to hear, I hope that you'll hear from some people who will be directly impacted and will see the direct impacts and benefits of expanding Medicaid. So first, I'd like to introduce Heather Eberly.
Hi, I'm Heather Eberly, and I'm here because on November 7th, we have the chance to tell 70,000 fellow Mainers that they matter. To the eye, I look healthy. However, 6 years ago, I was diagnosed with fibromyalgia. Fibromyalgia cast widespread pain, mental fog, and fatigue. Invisible, there is no blood test to diagnose this disease. It took many years of appointments with various doctors to receive my diagnosis. If not for Medicaid, I would not have learned what was happening to me. I could never have afforded the insurance to cover it. My boss at one point told me to come back when I had a doctor's note to work. My PCP, realizing that stress was repeatedly causing me to develop pneumonia, would not sign off on it. I became severely depressed. Life seemed to have no purpose other than to live in chronic pain. There were days I wished it would all just end, and suicide was on the table.
Wow.
With help from mental health professionals, due to my access to Medicaid, I made it through. I renewed my courage, and I persisted. I continued to see my healthcare providers, and when Dr. Rognall declared, "You have fibromyalgia, here's what we will do," I smiled. I smiled because I wasn't crazy. I had finally, with the help of Medicaid, received validation. Medicaid not only helped me, but it saved me.
And next we'll hear from Lilia Hawkins.
My name is Lilia Hawkins, and I live right here in Lewiston. For the past year, I've been without health care, and I've been reminded what it means to people already struggling to make ends meet. I had a good job that gave me a stipend to help pay for health care, and I was making too much to qualify for Medicaid. But my job didn't pay me enough to be able to afford insurance even with the stipend. Without preventative care and access to basic health care, tens of thousands of us here in Maine are set up for a future of bad health. Because what do? We go without, and that's what I did. Now I can no longer eat on one side of my mouth because I couldn't get the dental care I needed. Now the nerves are dead, and I risk getting an infection if I don't seek medical help. I have a 16-year-old that I'm raising alone. I have had to put my kid before my health, and yet I'm all he's got. What gets to me is that I've known for a long time that I had to do something about my health, but I couldn't afford to. So many of us are living paycheck to paycheck, trying to raise a family and facing impossible choices. Do I go to the emergency room and go into medical debt? Do I pay this premium or buy groceries or pay rent? When people with health care get sick, they're sick for longer. We worry about what we'll do if we have an emergency or get into an accident. All of this makes it really hard to keep steady work. Come to find out, sick people have a hard time keeping a job. Wonder, wonder. This is not good for Mainers or our economy. I don't feel like your health should ever be a question. It should be a given. You shouldn't have to ask, should I pay my rent or go to the doctor? Should I pay the premium or feed my children? I should never have had to ask, do I go to the doctor or do I eat? Right now, I am one of the lucky ones. My Medicaid was just reinstated last week. But what about the 70,000 people in Maine who still find themselves in the coverage gap, like I was? Luckily, we have a chance to pass Medicaid expansion this November and make sure that not just me, but tens of thousands of Mainers have the access to health care they desperately need. I've learned recently that if we pass Medicaid expansion, 90% of the cost will be covered by federal funds. 90%. Right now, that money is going to other states instead of coming to Maine. Medicaid expansion is common sense. We've heard the call from our communities, more health care, not less. So please vote yes on question 2 this November. It's important for everybody.
Thank you, Lynn. So next we'll hear from Dr. Liz Roth.
Hi everyone, thank you for coming today. I also really want to thank the other speakers who are telling personal stories. It takes a lot of guts to stand up here and tell a personal story. I think it's a lot harder than telling the stories that I'm going to do, so thank you for having the courage to do that. My name is Dr. Elizabeth Rosie. I'm a family medicine and sports medicine physician at Central Maine Medical Center. I want to share with you the story of several of my patients who would be greatly affected by expansion of Medicaid. The first patient, for his privacy, I'm going to call him Jim. He works full-time. He used to have a job that gave him health coverage, but he got laid off during cuts, and his current job does not offer health benefits. But he works very hard to support his family, including his diabetic wife. I never get to see Jim. He never can come to the office because he cannot afford it. I should see Jim. Jim has very high blood pressure that we've only been able to get under control by using 3 different medications. He worries, however, that the cost of an office visit would be too high, and so he avoids coming to see me. We've tried to select medications that are affordable, but with the difficulty in getting his blood pressure under control, some of the drugs are a lot more costly, and Jim can't afford to pay out of pocket for them, so he goes without. This puts him at a very, very high risk of having a heart attack or stroke. He's almost a ticking time bomb. If he did have one of those terrible, terrible health events, this would put him out of work and put his family in extreme financial difficulty. Jim is one step away from a health disaster and financial ruin because of his lack of health insurance. The second patient, who I will call Laura, also has a job, but she makes a lot less than Jim, and she also has no health insurance. Lately, I've been seeing a lot of her because she has a tooth abscess, an infection under the root. I've seen her several times for this, and we prescribe antibiotics when it acts up, but she really needs to have the tooth pulled, and the hospital has no dental services, and she can't afford a dentist. So she continues to come and see me instead of the specialist that she truly needs. Due to Laura's very low income, she does qualify for charity care from the hospital. That's how I'm able to see her. charity care or free care is mandatory for nonprofit hospitals. And not only legally, but ethically, we also give care because it's the right thing to do. But there are many, many patients like Laura who come to the hospital, and especially the emergency room, who are not able to pay their bill, and the hospital has to absorb the cost of that care. Hospitals, which survive on razor-thin margins, and patients and insurance companies paying their bills are what allows those institutions to keep the lights on and the doors open for people. Hospital cuts, positions, and even full departments are an unfortunate reality, and unpaid bills are a big reason for this. 2 hospitals in Maine have even had to shutter their doors, severely impacting their communities. For those who believe that expanding Medicaid would only help people who do not have a job, please think of Jim and think of Laura. Think of the hospital in your community. Keeping patients from having insurance severely impacts the health of people, and people who may be employed but also live on the edge, with just one catastrophic health event away from financial ruin. Caring for patients who cannot pay their bills puts hospital budgets in the red. It jeopardizes jobs, departments, and even entire hospitals. Maine needs to expand Medicaid. I would urge all of us to consider our fellow Mainers who may be less fortunate than us, our friends and our family who work in healthcare, and our communities that these hospitals support. Please vote for Medicaid expansion this November. Thank you.
And now, last but certainly not least, we'll hear from Melinda Stevens.
Hello, my name is Melinda Stevens, and I'm from Lewiston, Maine. Upon exiting an abusive relationship in December of 2010, I found myself in a very vulnerable situation and stressful situation as the sole provider and caretaker for my 2 daughters. Obviously, my daughters and I qualified for Maine Care. Providing basic necessities was extremely difficult on one income, and there would be no possible way for me to pay for the cost of health care alone. In the year following the exit of that abusive relationship, I had PTSD so bad that I could barely leave the house one year. And in that time, I abused alcohol to cope with that stress. If it were not for the mental health services that I gained during my recovery, I would have lost my car, I would have lost my home, I would have lost my job, my children, and quite possibly my life. My children are provided with immunizations, well child checkups, dental care, and medicine when they're sick. While I take pride in the fact that I live a healthy lifestyle and do an excellent job of staying away from doctors for illness, life happens. A couple of years ago, my youngest had a fever so high she ended up in the hospital. I had an issue with stomach ulcer and kidney infection, both bacterial issues that needed treatment with antibiotics. My oldest daughter gets therapy for some mental health care she needs as a result of previously living with domestic violence. I would be thousands upon thousands of dollars in debt trying to pay out of pocket for both my wellness care and the care of my children. And these issues do not just impact poor people. Those who are living paycheck to paycheck make too much to qualify for help and not enough to afford private insurance. And they're merely, as the good doctor said, one injury or illness away from losing everything. I think about where I'd be if I wasn't able to get the care that I needed as the sole provider for my children. Illness, substance abuse, mental health issues impact people from all socioeconomic classes. Healthcare is a basic human right. When people get sick, they can no longer care for their families or participate in the economy. This should be common sense to everyone. Healthy people equals healthy communities, and it's far more expensive to fix something after it's broken as opposed to creating a system of prevention. How many more hardworking people must continue to put off regular wellness visits because they can't afford it? How many people need to be hospitalized for health issues that would not have progressed so aggressively if they could have afforded medical intervention ahead of time. I urge everyone to get behind the preservation and expansion of Maine Care. This issue reaches across party lines, and we all deserve to have our health care needs met. Please vote yes on 2.
Thank you, Heather, Maiya, Dr. Ross, and Melissa, so much for sharing your stories and for sharing some of the reasons why we need to pass Medicaid expansion this November. For 70,000 people who have gained insurance, for our state economy, for all of us. We all really have a stake in this. And thanks for coming here today. I'm happy to answer any questions you may have.
Robyn, I know we've talked about this before, but the other side paints this as welfare. Is it welfare? Why or why not?
Well, so there's been an argument made that Medicaid isn't insurance, and I think it's clear that this is an insurance program. You heard from Dr. Roth about how it works. That these payments go to hospitals, to healthcare centers, to provide for healthcare costs for people. The federal law defines Medicaid as insurance. So there's, I think, there's no real dispute that this program is indeed insurance.
Do you worry that given the track record we saw with the legislature this last session, and the repeal of the 2% surcharge, the rolling back of the tip credit on minimum wage, I guess no action on ranked choice voting so far, do you worry that that kind of gate has been opened now, and especially with this current legislature with 128, that you guys can pass this in November, and in January they're repealing it?
We're not worried about that. This policy has been vetted. The legislature has passed this policy 5 times. It has the support, bipartisan support of the majority of both bodies. And there are legislative champions who are ready to work with all of us once voters pass this in November to make sure that it's implemented and to make sure that we all follow the spirit of the voters when they say yes to Medicaid expansion, and we work together to increase access to health insurance.
And to follow on that, do you worry what happens at the federal level of Congress? I mean, we've seen the Trump administration and the Republicans in Congress try to undo the ACA. They haven't been able to do it yet, but that's looming out there. It's clearly a top priority for them.
I think with the uncertainty at the federal level, I think it's more important than ever that we come together and stand up for affordable health care, for more affordable health care, not less. And I would also say that, as you point out, that this is still very much an option for Maine, that the federal funds are still available, and we have every reason to move forward and pass this in November.
All right, folks, if folks want to do stand-ups afterwards, the folks will be around. Let's not just keep everybody standing. We can get anybody you want to talk.
Thank you.
Thank you all.
Thanks all for being here.